Greetings of the day, guys. Today we are going to discuss about folliculitis. Folliculitis is an inflammation of hair follicles related to infection or chemical irritation or injury. It typically involves superficial bacterial infection of hair follicles with purulent material in the epidermis. Coming to epidemiology or microbiology, is usually caused by the pathogen that lives on our skin or a nasal carriage of this organism is a risk factor for folliculitis. Hot tub folliculitis or whirlpool associated folliculitis is often attributed to Pseudomonas species and occurs in inadequately chlorinated hot tubs, whirlpools, and swimming pools. Symptoms of uncomplicated folliculitis and whirlpool-associated Pseudomonas folliculitis are often mild and self-limited, and patients do not seek medical attention. Individuals exposed to whirlpool foot baths at male saloons are at risk for mycobacterial furunculosis. Okay. Candida species are implicated in patients receiving broad-spectrum antibiotics or glucocorticoids or who are otherwise immunocompromised. So now coming to the clinical features, the most common sites of involvement for folliculitis are apocrine areas of upper back, chest, buttocks, hips, and axilla. But folliculitis can develop in any hair-bearing region of the body, especially in the areas of repeated shaving. Folliculitis represents with clusters of pruritic erythematous lesions that are usually less than 5 millimeter in diameter, with pustules sometimes present at the center. So, there is a term, Pseudomonas folliculitis, that can develop over areas exposed to contaminated air, and lesions are often up to 3 centimeters. You see that it's 6 times more than normal one. Now, coming to pseudofolliculitis is related to a non-infectious condition more commonly seen in persons of African descent, secondary to shaving. It occurs when hair follicle becomes trapped and instead of exiting the follicle, curls and grows into the follicular wall. Such findings in the beard region are called Psychosis Barbae or Folliculitis Barbae. Okay, I'll show you the picture of Psychosis Barbae and can progress to deep infection that can cause facial scarring. How do you diagnose like Psychosis Barbae? Like how do you diagnose folliculitis? Mainly clinical. It should differentiate it from other disorders such as acne vulgaris, impetigo, fungal infection, contact dermatitis, scabies, insect bites, and viral disorders such as herpes. How do you treat it? Treatment for simple cases of uncomplicated folliculitis or hot tub folliculitis, stopping exposure or removing the offending agent, and twice daily cleaning with mild hand soap and often would suffice. Lesions usually resolve spontaneously, but if desired, warm compresses may be applied several times daily, and a topical antibiotic such as bezitracin, polymyxin B, or polymyxin D can also be used. Shaving should be avoided in the involved area. Okay, this is very important. Shaving should be avoided. Okay. Pseudofolliculitis is managed by allowing the hairs to grow 2 to 3 above the surface and afterwards using commercially available razors designed for this condition. Okay, for painful or more extensive cases, oral antibiotics with activity against streptococcus and staphylococcus such as cephalexin, dicloxacillin, or azithromycin are recommended. So you got it right. So thank you guys for watching it. I'll show you the Psychosis Barbae. Okay. Psychosis Barbae. See here, if you like to see here. So this is how a Psychosis Barbae would look like. You see that? There is a curling, okay, mainly seen in African descent, okay, and it must be, if you see acne vulgaris, it is similar to this. So you see that? So we must differentiate both of these things. Okay, thank you guys for watching this video.